Imagine waking up tomorrow and seeing everything crystal clear. No glasses, no contact lenses. Sounds like a dream. But what if I told you that a simple 10-minute procedure could make it your reality? But there are so many queries and questions from the patients regarding the LASIK surgery. Like, what is actually the LASIK? There are so many procedures out there like LASIK, PRK, Femto LASIK, and SMILE. And what is the difference among them? Who is eligible for these surgeries? And are you eligible? Am I eligible? To know the answer of these questions, we have Mr. Khurram Nasser with us again. Welcome, sir.
Thank you so much, Ms. Kashmala, and welcome back again. You asked so many questions, Ms. Kashmala, and exactly these are the set of questions which are being asked by so many patients, like what is actually the LASIK surgery and procedures, like and eligibility of the patient. So instead of rushing into the answers, let's break everything down into step-by-steps, so I can make it very simple, clear, and easy to understand for everyone.
All right, sir. So my first question is, what is actually the LASIK surgery in simple words?
Sure, doctor. So LASIK is stand for laser assisted in situ keratomalicious. So in simple words, LASIK we actually reshaping the cornea, right, to correct the different refractive errors. Like we can correct myopia, we can correct the hypermetropia and astigmatism by reshaping the surface of the cornea. So with the help of the LASIK, we can remove the glasses, we can remove the contact lenses, or we can remove any optical modality by simply reshaping the cornea with the help of the laser. And that is, in simple words, called LASIK surgery.
So, sir, let us know more about the LASIK surgery. Like, do we need to insert or implant any artificial lens inside the eye? Or how is it different from the cataract surgery? Like, what is the basic difference between the LASIK surgery and the cataract surgery?
Not at all, Madam Kashmala. There is hell of difference between the cataract surgery and the LASIK surgery. Cataract surgery is about, as you said, that we need to implant any artificial lens or intraocular lens inside the eyeball, right? But in LASIK surgery, we are not going to implant or insert any artificial modality inside the eyeball, right? What we are doing in the LASIK surgery is actually we are reshaping the cornea, the corneal surface, the corneal stroma. We simply remove a flap of the epithelium. As you know, there are 5 different layers of the eyeball: epithelium, right, Bowman's layer, stroma, like decimus membrane, and endothelium, right? So in LASIK surgery, we simply remove a flap of epithelium of the cornea and we reshape the stroma beneath that epithelium, right? And after that, we put that flap again on the surface of the stroma, and that can regenerate itself. As you know very well that the epithelium can regenerate itself.
Sir, as you know, there are so many procedures in the market like LASIK, PRK, Femto LASIK, and SMILE. So which procedure is the good for me or the person who's watching us, and what is the main difference between all of these procedures?
Yes, Ms. Kashmala, actually the PRK, the Photorefractive Keratectomy, is a procedure which is the older version of the LASIK surgery, right, or the laser surgery, in which we can remove the glasses permanently. It's not the modern version of the LASIK surgery, right? So what we are doing in PRK is like in LASIK, as I said about the Femto LASIK, we remove the flap. We just remove the flap of the epithelium. We reshape the cornea, the stroma, and then again we put the flap on the surface of the stroma, the flap of the epithelium, right? But that is not working in the PRK, right? And what we are doing in PRK then? We are actually removing the epithelium permanently, right? We are not making any flap. We are removing surgically that epithelium. Then we put excimer laser on the surface of the stroma. We reshape the stroma, and then the epithelium which we have cut down, that will regenerate itself. But the bad thing about the PRK, it is really painful procedures, and the recovery time is so many days. Like it can take 1 to 2 weeks approximately, right? And the good thing about PRK is if your cornea is like thin, right, which is not a good thing for laser surgery. I will explain it later. If the cornea is thin or there is a chance of trauma to the eyeball, then this PRK is fine. And if we talk about the LASIK, as I said earlier, that in LASIK surgery, we remove the flap, we reshape the stroma, and then put back that flap again, the flap of epithelium, right? But we are creating that epithelial flap with the help of a laser, right? And the good thing about the LASIK surgery, it is not time taking, it is not painful. right? And the bad thing about the LASIK surgery is it can create a flap related complications after surgery. And if you want to know about the femto LASIK, right? Like we make a flap with the help of, you know, the femto second laser, right? We are not use any blade like in LASIK surgery, like we use a microkeratome in LASIK surgery, right? But in the femto femto LASIK surgery, we use a femto second laser to make a flap of the epithelium, right? And the good thing about the femto laser is it is very precise, right? If you have higher prescription like high myopia or high hypermetropia or high astigmatism, that is the best option for the patient, right? And the bad thing about it is only one bad thing about the femto LASIK, and which is it is so much expensive. And finally, let's talk about the smile procedure, right? One word about the smile: it is a flapless procedure of the LASIK surgery, right? Of the laser surgery. Like in smile, we just make a tiny, incision of the small lenticule tissue of the cornea, right? And there is no any flap. There are no any flap related complications. There is no pain, and the recovery is very fast. So, in my knowledge, smile right now, the smile is the best procedure or the safe procedure, right? In LASIK surgeries.
Okay, sir. If anyone wants to go for the LASIK procedure, then what are the pre-operative tests he or she need to go for?
Yes, Ms. Kashmala, there are so many tests which are required to go for the LASIK surgery for any patient, right? And these tests are, first of all, the refraction, the subjective or the objective refraction, the exactly prescription of the patient, right? And after that, the CL time examination. You can check a thoroughly, visualization of the cornea, like lens, retina. You can make a fundoscopy procedure as well, right? Lashes, eyelids, everything, right? You can make an overview of the health of the eyeball, right? And after that, we can go for, because the LASIK surgery, either it is PRK or it is femtosecond or it is LASIK surgery or smile, whatever it is, we are actually reshaping the corneal surface, right? So all the tests should related to the cornea, right? So we can go for the corneal topography, number one. We can go for the pachymetry. We can measure the corneal thickness, because the corneal thickness is very important while we are doing or performing the LASIK surgery of any type, right? And after that, we have pentacam, we have corneal topography, we have pachymetry, we have dry eye, right? Tests like tear film breakup time, right? These are important, tests for the LASIK surgery.
Okay, sir. You said corneal thickness is very important in these procedures. Please tell us how it is very important.
Yes, no doubt at all, Ms. Kashmala. Corneal thickness got the vital role in LASIK surgeries, right? Let me elaborate it. We all know that the CCT, the central corneal thickness, is very important, right? And the central corneal thickness is about 500 to 550 microns, right? Collectively, like including epithelium, stroma, and endothelium, every layer of the cornea, right? So in LASIK surgery, what we are going actually, we are reshaping the corneal surface. In simple words, actually, we are thinning the cornea, right? For example, if we are treating myopia, so in myopia, the cornea is too steep, right? And in myopia, in LASIK surgery, we are actually making the central portion of the cornea flat, right? To correct that myopia. And what we are doing in hypermetropia, you know very well that the cornea is too flat because we got less power in hypermetropia. So in hypermetropia, actually, we are putting the laser at the center corneal portion, right? And we are in hypermetropia, we are actually making that center of the cornea more steep to correct that hypermetropia. So in myopia, we are working at the center of the cornea. In hypermetropia, we are working at the center of the cornea. But what is the difference then? In myopia, the central cornea is too steep, right? Power is high. So we make it flat with the help of the laser, right? And what we are doing in hypermetropia, the central portion of the cornea, right, is more flat, right? And with the help of the laser, we are actually making it too steep, right? So we are actually doing that. But in both cases, we are thinning the cornea. In both the cases, we are making the cornea thin, either in hypermetropia or in myopia or in astigmatism, right? We are actually making the cornea thin, right? So corneal thickness is very important. As I said, the corneal thickness is 500 to 550 micron in the central corneal thickness, right? So we are actually burning or ablating the central cornea to correct the refractive errors like myopia, hypermetropia, and astigmatism, right? So what is actually the procedure? Let me tell you one thing. So, for example, we are going for the LASIK surgery, right? And total thickness of the cornea, central cornea, is 500 to 550 microns. And we make a flap, as I said earlier, right? And the thickness of that flap is 100 to 110 microns, right? So 100 microns is already removed, right? And rest of the stromal bed is there right now. So we are putting the excimer laser on the surface of the stroma, right? And let me tell you one more thing, that if you want to correct one diopter of the myopia, you have to ablate approximately 10 to 12 microns of the cornea, right? So for example, if the myopia is of minus 4 diopters, you have to burn the 40 microns of the stroma, right? So you can see how the corneal thickness is important. So if myopia is minus 10, so you better know that how many microns we have to burn, how many microns we have to ablate. So we have to know the proper corneal thickness before doing the LASIK surgery or any kind of LASIK procedures, laser procedures in the eyeball, right, on the cornea.
Very interesting, sir. You nailed it. Sir, let me know what is the eligibility criteria if I would go for a LASIK surgery, or the person who is watching us right now, how would he know that he is eligible for the LASIK surgery or not?
Yes, Ms. Kashmala, the eligibility criteria is very important. And the first thing in this criteria is the age of the patient. Your age must be more than 18 to 20 years, more than this age criteria, right? And the next criteria is the tear film stability. There should be enough moisture in your eyeball, right? And the next thing is your stable prescription. Your prescription should be stable. You must be stable at least for 1 year, right? And the next thing is there should not be any active infection or inflammation inside your eyeball. Like there shouldn't be any keratoconus or corneal ectasia or any disease of the cornea. And last but not the least, the corneal thickness. As I said earlier, corneal thickness is very important. Your corneal thickness should be 500 to 550 microns. And after the surgery, a term which is very important in ophthalmology, and that is called the residual stromal bed. The residual stromal bed. What is this? This is the residual stromal bed is actually after the surgery, post-surgical corneal thickness. This is called the post-surgical corneal thickness after the surgery. So how many microns are there? How many microns are retained in the cornea, right? And the value of the residual stromal bed is at least 300 to 310 or 350 microns. These microns should be retained. These microns should be there after the LASIK surgery.
Thank you very much, sir. But my last and most important question is that, is it possible for the vision problems or the refractive error to come back after the surgery?
Yes, exactly. This is very common concern from the patients. Like, it's true that the LASIK surgery or any type of the laser surgery like SMILE and PRK gives, the satisfactory, that is results. But in some cases, the refractive error can come back again. And the first thing is like the age-related changes. Like, for example, if you go for the LASIK surgery in early 30s or early 25s, right? Then after 40 years or 45 age, you got the presbyopia. And presbyopia is aging process. So the glasses, the near vision glasses will come back again. You have to wear your reading glasses, right? This is case number one. In case number two, like if you're having a medication, like if you have got some hormonal changes, like if you got pregnancy or, if you got some medication, certain kind of medications, then glasses can come back or the refractive error can come back again. Or if you got, very well that in different cornea, the healing variations are there, right? My cornea is not the same as yours, right? So the healing variations are different in different cornea, right? So this can make the refractive error come back again. And the last thing is the high prescription. As high the prescription is there in terms of myopia or hypermetropia, there will be a small chance for the refractive errors to come back again.
Thank you very much, sir, for your incredible talk and time.
Thank you so much, Ms. Ishmala.
If all of this makes sense, then you are now equipped with the basics of the LASIK. And of course, if you have more questions and anything you are curious about, then drop them in the comment section below. We are happy to answer them. Thanks for listening and see you next time on our Eye Care podcast with Khurram.